Bipolar disorder has received more notoriety within the past decade due to rising numbers of fatalities and suicide attempts. Most think bipolar disorder is a series of small mood swings that can be shaken off with a fun comedy show or optimistic insights from a loved one, but that's not the case. Individuals who suffer from bipolar disorder experience the mood swings of an average person, but to an extreme for long periods of time. The two most common mood swings are manic and depression. In a manic state, individuals experience a feeling of being able to conquer the world, as well as extreme irritability. Other symptoms of manic episode include racing thoughts, little sleep or fatigue, as well as making impulsive decisions and engaging in high-risk behaviors. Depressive episodes are the complete opposite of those experienced in manic. During a depressive episode, individuals feel tired or lethargic, have difficulty concentrating, remembering things, or making decisions. They are also restless, irritable, and change their eating and sleeping habits. One major difference seen between the two is that during the depressive episode, individuals experience thoughts of suicide, death, and some will attempt to terminate their own life. Many scientists believe bipolar disorder is often acquired through genetics. Those with a family history of the disease are often at higher risk. It is also believed that there are numerous environmental factors that can trigger the onset of bipolar disorder, such as the death of a loved one, drug abuse, high stress levels, or major life changes. With many contributing factors, scientists have not identified a clear reason why the disease emerges in a person. According to the National Institute of Mental Health, at least half of all cases start before age 25, and the disease usually shows symptoms during the individual's late teens or early adulthood. Because bipolar disorder is a disease, it affects various aspects of an individual's life. If left untreated, bipolar disorder can have many negative effects, including financial problems, poor performance and attendance at work or school, strains on relationships, and eventually suicide. The central nervous system and brain are directly affected by bipolar disorder due to an imbalance of neurotransmitters. The limbic system, as well as the prefrontal cortex, are structures affected by the functions of bipolar disorder. The limbic system houses important structures needed for emotional response, including the thalamus, hippocampus, and amygdala. The hypothalamus is responsible for emotional behavior and responses as well as the circadian rhythm, or the sleep-wake cycles. The long periods of going without sleep or having too much sleep during the depressive episode is due to the brain's inability to reabsorb serotonin, a neurotransmitter. Individuals with bipolar disorder will also experience an excessive amount of dopamine during their manic episodes, which allows them to feel a state of euphoria, as it is located in the pleasure area of the brain. These two chemicals, along with norepinephrine, work hand in hand to control the behavior of a bipolar individual. If you or someone you know is suffering from bipolar disorder, the best thing to do is to educate yourself on the disease so you may better empathize with those living with it. If you're helping someone with bipolar disorder, it's best to offer emotional support, patience, and understanding. Also, remind your friend or family member that with time and treatment, there is hope for their disorder. If you yourself are suffering from bipolar disorder, you should talk to your doctor about treatment options. Try to maintain a regular routine, and learn the warning signs for when you're about to slip into a manic or depressive episode. Many doctors may prescribe therapy and certain medications to stabilize your mood. Medications such as lithium and antidepressants can have very harmful side effects. These side effects include restlessness, dry mouth, and severe depression. Because bipolar disorder is caused by a neurochemical imbalance, The process for finding the right medication is about trial and error. While trying to find the best medication, individuals are closely monitored by healthcare providers. If you experience any thoughts of suicide, contact your doctor immediately.